John Showalter. I'm the Chief Product and Strategy Officer at Linus Health. I'm an internal medicine physician by training, but at Linus I lead the overall development of digital cognitive assessments and clinical decision support.
Excellent. So cognitive assessments, clinical decision support. Tell me a little more about Linus and the work that it does.
So Linus's mission is to bring brain health to its rightful place in the standard of care. We talk a lot about heart health. We talk a lot about chronic disease management. We don't really talk about taking care of your brain, despite the fact that if you have cognitive impairment or dementia, you really begin to lose yourself. So there's nothing more core to your being than your brain, and it's not the first thing we talk about in primary care, and it probably should be.
Yeah. And so what are the types of, I understand the problems or the importance of brain health, and you're right, it's not at the forefront. How are you looking at addressing those problems?
So one of the reasons it's not at the forefront, or probably the main reason it's not at the forefront, is because it's hard. And we really need to bring technology to primary care where they can accurately understand if someone's having a problem. You know, we have blood tests for diabetes, we have a blood pressure cuff for hypertension, we have mammography for breast cancer. We don't really have anything right now for brain health. Well, actually, I take that back. We do now, as of the last 12 months.
Yeah.
There is a tool that's being used by hundreds of primary care physicians to do the assessment of people's brain in their clinic, get real-time results, deal with it right then and there, and help people keep their brain healthier. And that is Linus's digital cognitive assessment. But that's been a major game changer in the ability for primary care to actually deal with this problem because they didn't have the tools.
Yeah. Well, and not being an expert, but if I was to be asked about what are the assessment tools that are used in brain health or I guess mental health, it's a lot of subjective questionnaires, and it's difficult to, it depends on the way that a questionnaire is answered or even the person that's completing it, their interpretation of said response. Is that where we're going?
Yeah, so, on the mental health side, there's a lot of interpretation on the questions. There's actually a lot of complexity to those questions. If you have somebody who has cognitive impairment, so something as simple as a standard PHQ-9 for depression can be really confusing for someone to answer on a scale from, 1 to 5, 1 to 3. How many, if you can't remember last week, how many days last week did you have a problem? You can't really do that.
Yeah.
So there are better scales, like a geriatric depression scale, that are simpler for them to answer or more accurate in the elderly or cognitively impaired. And the ability to use something like an iPad and analyze at 120 times a second really gets to a point where people can't change the answer, affect the answer. It's much, much more reliable. We've done a number of head-to-head trials of paper and pencil tests to the digital tests, and we win every time.
Yeah. And then help me understand a little bit more. What does the test actually look like? What's involved? Yeah.
So the test is on an iPad. It talks to you. It allows a medical assistant to standardize it, make sure you understood the instructions. But the iPad talks to you, gives you words to remember, gives you instructions of what to draw, gives you prompts like how many animals can you say in a minute.
Yeah.
And then we analyze the voice, not just the answers or the drawing, not just the final picture. And it gives a much more granular view of somebody's brain.
Yeah.
And the studies we had are fantastic. There's over 50 peer-reviewed journals on exactly how detailed you can get with these tests. We then roll up all that details into a simple plan that really any physician can follow.
Yeah, amazing. And so what brings you to health?
So came to health because I was on the Brainiacs panel yesterday, and that was all focused on elevating this conversation about brain health and really getting the word out that 50% of dementia is preventable, that we can cut the number of people over the next several decades by potentially half or maybe even more than half if we intervene early, find them when they're able to make lifestyle changes, and really get them to take their medications appropriately, stop taking the medications that they're not supposed to be taking, and work with them to optimize their overall health.
Yeah.
We can get people to continue aging with their brains.
Yeah, that's important. And so, you mentioned the product's been 12 months-ish in market. There'd be a lot on the on the roadmap, I imagine. What are you working on over the next 6, 12, 24 that we can look forward to seeing?
So we've been really focused on delivering to primary care in their clinic a reliable test. Over the next 6 to 12 months, we're going to be rolling that out to the home.
Yeah.
And rolling that out with additional testing so that you can not take your clinic time, which is very precious, and get this done at home, get this done in a setting that's more comfortable to the patient, and allow them to get that information back. We're also going to be rolling out additional enrollment software to help recruit people into clinical trials because Alzheimer's disease and dementia trials take the longest to fill. If you compare them to something like how long it takes to fill a cancer trial, it's up to 3 times longer. So we're going to be also helping people doing the studies bring those drugs, bring those interventions to market faster by helping them find the individuals that they need.